Thank you, Dr. Barlow, for receiving me here today.
It's my pleasure.
I would like you to introduce yourself.
Well, I'm David Barlow, and I'm the Director Emeritus of the Center for Anxiety and Related Disorders here at Boston University. And this was a research and teaching clinic that we founded over 30 years ago now to focus on the nature and treatment of anxiety and depression and related disorders.
What do you think would be the hot spot today for working cognitive therapy and anxiety disorders?
We spent a lot of the first 20 years developing new and effective cognitive behavioral treatments for the different anxiety disorders. One of the first treatments we developed was for panic disorder, which has been widely used around the world. I'm very pleased to see that. We've also developed treatments for other specific disorders, generalized anxiety disorder, for example. But now I think we're moving on to a new phase where we are attempting to look and see what are the commonalities among these disorders, and are there some common targets shared by all of the disorders? Are there transdiagnostic mechanisms in these disorders that we can treat more directly and perhaps more simply? Right now we have many different protocols for different disorders, whether it's depression or panic disorder. So we're looking to see, can we identify some common elements or principles which are very much cognitive behavioral in their nature, that would be effective for all of these disorders, that would make life a lot simpler for clinicians who would not have to master so many different kinds of approaches. So that's what we're doing right at the moment. We just finished a large 5-year clinical trial from the National Institute of Mental Health, showing that this new unified protocol, as we call it, is at least as effective as the individual protocols that we worked on previously. Right now, we have tested a version which is about the same length as the typical cognitive therapy protocols. However, it's designed to address not only the major disorder the patient presents with, such as depression or generalized anxiety, but also all of the comorbid disorders and the sub-threshold kinds of presentations. Well, we do work with patients to understand that emotions are obviously a very normal part of our life, that sometimes can become very troublesome when they get too intense or interfere with our life. And so we present some basic conceptualizations of the function of emotions, when they are normal, when they become dysregulated or disordered, and how we can help them achieve some control over their emotions once again.
Would you say that you are going more, or cognitive behavioral therapy, or going more for the approach or the importance of the emotions?
It really is focused on emotional disorders, but it is very much in the tradition of cognitive behavioral therapy.
What would be your desire or your bet for how this could be from 10 years from now?
Well, I think where we're headed now in the future, I wrote an article recently on the neuroscience of psychological treatments, and it reflects the growing interest in examining the underlying brain structure and function associated with the effects of our treatment. So in other words, when we utilize our cognitive behavioral treatments, we now know that we're changing more than just behavior and thoughts. We're actually changing how the brain is working.
Yes.
And by determining and delineating the specific effects we're having on the brain and monitoring these changes, it may be that we will be able to enhance the effectiveness of our treatments by taking this more comprehensive point of view.
One thing that comes to my mind once in a while is if we could trace what kind of techniques of the whole approach of cognitive behavioral therapy, if you could study the brain, what were the best techniques? Is there something going on in this kind of point of research or?
Yes, yeah. I think it's just beginning.
Yeah.
So there was a special issue in the journal Behavior Research and Therapy last year that focused on that focused on the very exciting research looking at how we can integrate research from neuroscience with our cognitive behavioral treatments, perhaps to the benefit of both areas of study. So it's the future, I think, will see this kind of integration.
Okay. Thank you very much for your time, for your attention.
Well, it's my pleasure, and best wishes to all my friends in Brazil.